As we are all being bombarded with social media posts giving thoughts and advice as to how to stay healthy and well, not just from coronavirus or COVID-19, we wanted some expert thoughts on how we can boost our immunity and what can potentially compromise our immune response. And to help us out, welcome back to the show, Dr. Frances Pitsilis. Good to have you here again this week.
Thanks,
You've been
Mike.
busy, haven't you?
Yes.
Okay, immunity really important, especially the current environment that we're in. What compromises our immunity?
Well, if you've got a chronic disease, you're already compromised. And if you're on immune suppressant drugs to help you with your disease, that puts you on the back foot. So anybody who's got anything chronic, anyone older, because their immune disease naturally doesn't bounce up to help you quite as well. It can run in families. You can have a genetic problem. And the rest of it is all lifestyle.
Okay.
It's how you look after yourself and eat and sleep and exercise. And a particularly vulnerable group that may not think about it are the shift workers.
Okay.
Yeah, so that's anything sort of outside of 8 a.m. to 6 p.m. And if you go to bed very late, you won't make your own natural melatonin, which is a very powerful antioxidant.
And when you talk about lifestyle, smokers as well, I presume?
Yes, absolutely. Smokers are going to be depleted in vitamin C, antioxidants. They get poisoned by chemicals and they also get arsenic.
What could be the symptoms of low immunity? How do you know that your immune system is down?
Well, the obvious one are people who say to you, I get a lot of winter illnesses during the winter.
Right.
Now that's my clue straight away to look at vitamin D, vitamin C, zinc and selenium. And some vitamin A. Some people get recurrent herpes infections. They tend to get them when they're stressed.
Right, so that's a sign that your immune system is low.
Yeah,
okay.
Because any sort
good.
of stress, whether it be psychological or physical, or a drug that you're taking that's affecting something, can deplete you. So in this situation with herpes breakouts, I think of zinc and vitamin D.
Okay.
Now, getting tired, not sleeping properly, getting a new disease that gets diagnosed, and of course we've already mentioned the vulnerable, who are the older and the chronically ill. So what can you do to boost your immunity?
Yeah. What do you do? Are there vitamins you can take?
There are, but you need to do fundamentals, which is be in bed and asleep by 10:30.
Right, okay.
Right, because
things that don't cost you any
because
money.
after that, at 10:30 you start making melatonin. So if you haven't done that, you won't make your own melatonin. Get 7 to 9 hours. People tend not to get enough, and avoid too much blue light late in the evening,
which like surfing your phone?
Yeah, the phone, which suppresses your melatonin. Do any sort of exercise or meditative, probably both, and meditative activities like yoga and meditation, because they increase your natural killer cells, which kill viruses and cancer.
Okay, great.
Right?
What about
killer
foods?
Cells. Food. Green smoothies, green veggies boost B vitamins, but you really want adequate protein and a rainbow of colours on your plate so that you can get all those different plant antioxidants, and you keep your processed foods, your sugar and your starch right down.
Right, so this is like putting oil in your car. Keeping your immune system in check is making sure that everything's running good. Can your doctor help with that?
Yes. Now, apart from mainly looking after your lifestyle, which is your responsibility, if you wish or you're worried, your doctor can check your vitamin D levels, your iron levels, your B12 levels, and even your folic acid levels, and then help you to get those really optimised. And your doctor can also help you get the best possible control over any chronic disease that you might have, like diabetes type 2.
Does your doctor automatically test you for these things, or do you have to ask?
Doctors are very busy, have short appointments, and they also have to look after spending, so you have to ask.
Okay, great. What about vaccinations? Do they help?
Well, I think none of the vaccinations that we currently have are going to help us with COVID-19. However, I think that if you're vulnerable, you need to talk to your family doctor about whether a flu vaccine is a good idea, possibly even the pneumococcal vaccine, which is for a bacteria, but it's still something that may compromise you that you could prevent. They're the main ones, possibly even the shingles vaccine. If you're over 65, it's free.
Right, okay, brilliant advice. What about supplements and herbs?
Now, with the vitamins, I think you get a good vitamin that's got selenium in it and some vitamin A. Vitamin C has been shown to prevent the white blood cells going into the lungs as part of a pneumonia and getting all the fluid in the lungs. So it's been found to reduce pneumonia. And I've recently heard that the Chinese are doing a clinical trial on intravenous vitamin C.
Wow.
And the Americans are having a look at it as well. So do a zinc taste test in the shop and take some extra zinc. B vitamins can be important for stress.
Yep.
And take a probiotic for your gut flora, because the gut is the centre of your universe for your health.
Okay.
Now, when it comes to herbs, 3 came to my mind, but there might be more out there for people to look up. Olive leaf extract definitely prevents influenza, olive leaf extract, so it may have some effect. Echinacea and astragalus.
Okay, great.
Okay.
So when you're looking at, say, something like a multivitamin, make sure that you've got the vitamins in it that your body needs. And everyone's going to be slightly different?
Multivitamins are not going to have much of anything in them.
Right.
But what you need to do is have a look at all the different multis and have a look at the numbers. Some of them have got very little B vitamins and very little of anything else.
Okay.
But you'll find some that stand out and you'll work it out.
Okay,
Yeah.
brilliant. And finally, Dr. Frances, what else would you recommend?
Stay in touch virtually with your positive, happy friends and avoid miserable, negative sorts of things.
Well, there's been a bit of that, hasn't there? Yeah,
yes.
okay.
So stay positive, have a laugh, look at the funny side of it and all the funny things we see on the social media, and share a problem that concerns you over the internet or the phone.
Okay, so stay positive. Thank you very much, Dr. Frances Pitsilis. You have been awesome this week. We really appreciate it. Thank you so much. And if anything we discussed today is of concern and you want further information, make sure you contact your own healthcare professional.